So I just want to tell a little bit about this project. It's part of a CIHR, which is the Canadian Institute of Health Research, funded research here in Canada. We launched this project about 3 weeks ago. It's part of a larger project with some colleagues of ours at Ryerson University in Victoria, BC. The website that we launched 3 weeks ago is called COVID-19 misinfo.org. We knew in the lead up to this pandemic that there will be a lot of misinformation. This work is coming out of our previous work on political misinformation. So we adapted many of the tools and techniques that we use to study that phenomena to prepare ourselves for launching this particular project. On the screen, you can see that that's the front page of this portal that we created a couple weeks ago. The portal has two main components. The first is a few information visualization dashboard. There's one that basically takes debunked fact-checked information from around the world and bring it to one place, because we knew that different organizations will be doing fact-check around the world, but we knew it would be difficult for people to find them all. So we knew we had to gather it on one place. I'll talk about that one in a little bit later. The other thing that we were concerned about was the use of bots in the Twitter conversation about COVID-19. So we knew that journalists and others will want to know and get some help on identifying accounts that are bots or exhibiting bot-like behavior. So we created a dashboard that basically analyzed tweets that are talking about COVID-19, about the coronavirus, and then we analyze each and every one of those accounts to see which one are likely to be using some form of automation. So this way, it gives journalists and other researchers a head start as to where to look. And the third component of our portal is a Facebook and Instagram trending post dashboard. Again, because we know that many people are on Facebook, and in times when people are mandated to physically distance or socially distance themselves, they're going to turn to platforms like Facebook and Twitter and others to connect, to stay connected with their family. And then the other part of the portal is basically just basic stats, because we also knew that there will be a lot of coverage of the US and other larger countries. So we wanted one place where we can get some stats in front of people. That's why our tagline is "Come for the misinformation, stay for the facts." Because we realized that if we bring people here and show them the misinformation, we knew that we had to provide them with additional facts that they can walk away with so that they can change the way they behave, the way they act. And so it's not just about the misinformation, it's really about the facts. We also started curating explainer content, because again, we want to provide people with accurate information that's been curated and vetted so that they arm themselves to basically fight against the infodemic. And then we also, because Canada is a federal country, the health authorities resides in each province, and each province have control over their health authority. So we knew there would be a lot of confusion as to who to call, simply because we live in a media ecosystem that's highly linked. So as a result, you could be watching a newscast with a story coming out of British Columbia or coming out of Ontario with different information. So the average person might not be confused as to where to get the information they need. So we knew that we had to create a clearinghouse for everybody. So I'm going to go into a little bit of detail about the misinformation dashboard that we created. So we pulled the data for this from the Google fact-checking tool. It has an API that allows us to then get the data from various journalist groups that are doing fact-checking from around the world. They put all their results into this database. But the problem with the database is that it's all over the place, in the sense that each of the partners in this project are using different ways to talk about and to rank the type of misinformation that they find. So for example, somebody might say "for Pinocchio" as something that's a lie, and another organization will say something that's not correct or is false is not false. So as a result, we had to clean up the data and normalize it, so this way we can then visualize it, and anybody can go here and They can choose the language, they can choose the day, the source, and so on. And then they can see the type of misinformation that's floating around the internet all in one place. What makes this useful, again, is that it allows research like us to basically get a bird's eye view of the type of information that are going around the world and their commonality. What makes them similar? Are different parts of the world pushing different types of misinformation? What do they share in common? What makes them different? And the other dashboard that we created that came out of our Misinformation on Politics is our Tuna dashboard. We basically captured about 40% of all tweets that contain the word coronavirus or the word COVID. And then we analyze them to look for evidence of bots being in the conversation. And then we pull them out and highlight them. And this will allow anybody to go to the dashboard, click on any of those accounts to investigate for themselves and decide whether this is an account that they can trust. And the other unique things about this particular dashboard is that we also automatically analyze each and every link that's being shared in the conversation about the coronavirus or COVID-19. We have, over time, built up a dictionary of URLs from mainstream media, from government agencies and government, and then also from blacklisted websites that we know from previous experience that have passed on misinformation. So now every time somebody tweets something, our system can automatically group them and categorize them. Hi, is that link going to a mainstream media? Is that link going to a government source? Is that going to a political party? Is that going to a blacklisted website? So again, the good news is that on average, more than 50% of all links that people are sharing when they talk about this topic is going to mainstream media. It's going to government website. Less than 1% of all the links are going to known misinformation purveyors, bad actors in the system. So here are some of the lessons that we have learned from just watching and analyzing this data day in and day out for the last 3 weeks. One of the things that I find disheartening is that the public health agencies are actually contributing to the infodemic. I realize that this is a moving target, but to instill confidence and set the expectation, the health agencies need to reiterate again and again that this is a new virus and that recommendation will change with more data. Because what we're seeing is that older recommendations from weeks ago are now being weaponized by bad actors as proof that there is something nefarious going on, when it's simply because the information is changing and the recommendations are being changed based upon new data. And also, there needs to be more coordination between agencies within each country. They need to agree on a common term of reference. What are confirmed cases? Because, for example, we're watching as country to country, province to province, each one have their own definition of what are confirmed cases. So as a result, after a while, it's hard to figure out what to believe, what the numbers are. The other thing is, we know the social media influencers have already have an audience. I know that there's effort already to draft them in, but one of the way to increase buy-in, as another presenter earlier mentioned, is to look at the economics. So when you push out content that they can reuse, allow for some creativity and personal branding, because that would then give the influencer an extra incentive to share this within their network again and again. The other thing that we notice is government needs to work with domain registrar to act against fraudulent COVID-19 website right away. This is a lesson that I think we need to learn for future pandemics. As soon as we identify a new pandemic or a problem, the first thing is somebody needs to reach out to the registrar. New websites are an important vector for the spread of COVID-19 misinformation. They need to halt the automatic registration of domain names. So this way, anybody who want to register anything that's COVID-19 related has to go through a human being first. So this prevents fraudster, scammers and fraudsters from using COVID-19 website to sell whatever snake oil that they're selling. And the other thing is that health agencies and government need to work with media to implement old article features. This will reduce the number of old stories that gets recirculated as new. Some of the larger media organizations already have this, but the problem is that some of the smaller, underfunded local media agencies and newspapers don't have this capability. We need to work on how to give that feature and that ability to smaller organizations, because this is an important vector, and it's being weaponized where they're using outdated information. And last thing, we need to start running PSA about infodemics and educate people on how to develop and practice digital hygiene. This is similar to how we currently teach people how to develop routines and practice for personal hygiene, hand washing and so on. And the last point I want to make is that we need to make it socially acceptable for people to retract and delete inaccurate posts that they might have shared. Because right now, a lot of people are unwilling to remove things and take things down because it's basically viewed as, well, them admitting that they're wrong. But we need to start making it so that it's socially acceptable for people to remove those things, and we need to encourage that as a society. So in closing, those are some of our early observations. Thank you. If you have any questions.